Afternoon. It's Good Friday, the 10th of April 2020, just after 1 o'clock. Welcome to UK Column News. I'm your host, Mike Robinson. Joining me in the studio, Patrick Henningson from 21st Century Wire. Welcome to the programme, Patrick.
Great to be with you, Mike.
We will just get straight on with the latest statistics on COVID-19. 1.6 million global cases now. 96,939 deaths is the latest stat. Global recoveries up to 365,789. So that means that active cases at the moment, 1.154 million active cases, of which 1.1 million are mild and 49,184 are considered serious or critical. Now, of course, the subject on everybody's minds at the moment, Patrick, is the lockdown. Now, it's been very interesting that in the live streams that the British government have been putting out over the last week or so, the mainstream media, when they've been asking questions, have always asked, what's the exit strategy? When are we getting out of this? What's going on? Well, Dominique had a little bit to say about that yesterday.
Today I chaired a COBRA meeting with senior ministers, officials and representatives from Scotland, Wales, Northern Ireland, as well as the Mayor of London, so that we could take stock and assess where we are right across the United Kingdom. And at this stage, the government is continuing to gather all of the relevant data to obtain the fullest picture possible of the effects of the social distancing measures that we've put in place. Now, while the early signs suggest that they are having the impact that we need to see, it's too early to say that conclusively. SAGE will meet next week to discuss the latest evidence and will keep the measures we've put in place under review. As we've said on many occasions now, we'll be guided by the science at all times. So we don't expect to be able to say more on this until the end of next week. And let me just be, again, very clear about this. The measures will have to stay in place until we've got the evidence that clearly shows we've moved beyond the peak.
So they're going to be guided by the science, Patrick. They're going to rely on the data. So let's just have a look at this data. So on screen now, then, we have UK COVID-19 cases. These, of course, are the numbers of people that have ended up in hospital that are confirmed cases. So, you know, what we see there is that there's a bit of a curve on that. You know, I mean, it is a logarithmic scale on this graph. That's appropriate for this type of virus propagation. Linear scales, misleading, as Andrew was saying in last Friday's program, misleading in this case. So that's probably why the mainstream media likes to use them. But if we had a constant growth here, for example, it would be a straight line on a logarithmic graph like that. Now, thankfully, it hasn't grown as it seemed to imply in the early stages. It hasn't even grown at this rate, Patrick, which is significantly less slow growth. So you can see that it's growing slower than a constant rate.
And just to be clear, when you're talking about growth rates, Mike, you're talking about the rate of acceleration, right?
Right, yes. Right. And so what happened when they introduced the lockdown? Well, this was the date of the lockdown, the 24th of March. And as you can see there, if you look at these statistics, it does appear that the lockdown has had some positive effect because the growth is slowing since the lockdown. But there's a pretty big caveat on this because, as it says in the brackets at the top there, these are notified cases. These are people that have appeared in hospital with symptoms and the hospital has agreed that they have the disease. Now, as many of the mainstream press have been pointing out over the last couple of weeks, of course, you could be asymptomatic for a couple of weeks before you display any symptoms. So in order to see whether the lockdown has actually had any effect, we need to move these statistics back from the date of notification to the date of, we'll just show the gap there, but to the date of onset. So this is, we've moved the data to the left by 2 weeks because this is probably when people got the disease in the first place.
Or most people.
Most people, yes.
Around February 15th, right?
Right, and so we can extrapolate that out. Now that's an extrapolation. It's not accurate. We don't know what's going to happen in the next couple of weeks, but it shows the trend in the curve. And when we add on the lockdown on the 24th of March, then we find that in fact, if you look at that, the cases were already coming over the top of that curve well before the lockdown was announced. So I don't think the government at this point, I think this clearly shows that the government at this point cannot claim that the lockdown is responsible for the slow in the number of new cases.
So clearly it was leveling out already, Mike, by the time the lockdown was announced.
That's absolutely right. So the question is, back to the government, you maintain that the data is driving your decisions. I'm afraid the government is going to have to explain this in more detail, because the data does not seem to be what is behind their decisions. They seem to have made the decision about the lockdown in spite of the data.
The reality is, Mike, that the virus had already made its way through the population long before the lockdown. This is what other scientists, what other heads of medical and health authorities are saying in other countries around the world. So to think that it just appeared all of a sudden at the beginning of March is factually untrue and is not being guided by the science, in fact.
So Patrick, we're going to look at the difference between non-lockdown and lockdown.
Well, this is an interesting story. Let's look at non-lockdown countries versus lockdown countries, Mike. Take a close look at here. We've got a scale that we've set up. This is the deaths per 1 million. As you can see, there's the key. The red line is deaths per million. And if we just add in here, these are the cases per million. So if you look at the bottom, on the left-hand side, you have the non-lockdown countries in white: Sweden, Iceland, Mexico, Belarus, South Korea, Japan, and Taiwan. And on the right, Mike, you have the lockdown countries, starting with the main European countries, the UK, France, Germany, Spain, Italy, Belgium, and also the United States we threw in there as well. And what's interesting in looking at this graph, Mike, comparing the non-lockdown countries to the lockdown countries, surprisingly, Mike, the non-lockdown countries have much lower deaths. And of course, the Icelandic green bar there, that's cases per million. That's because they have tested 25% of their population in Iceland. So
they've done much more testing than anybody else in the non-lockdown category?
Yeah, so basically that's why that green bar is so high. But the real number here to look at, Mike, is the red line. This is deaths. This shows the effectiveness. So we can say safely, Mike, that non-lockdown countries are doing just as good or better than lockdown countries. So you have to ask yourself the question, Mike, if they're getting the same results or better results without having to implode their economy, without having to destroy their society, without having to ruin the business sector for potentially a generation, the small to medium-sized family-owned business sector, the self-employment sector, the damage will ripple for decades. They haven't done any of that, and yet they're getting better results. So the argument that the lockdown was a good choice, this is definitely something that is up for debate right now.
I mean, if we look at that again, Mexico, for example, they seem to be moving. They're implementing a lockdown now increasingly. So I'm wondering why they've decided to do that. Bearing in mind, this graph is showing quite clearly that while there was no lockdown in place, they were doing very well.
They're probably doing that because of public pressure. As we'll show you in a minute, a lot of countries are getting pressure from the media, from international organizations. But countries like Mexico is doing random sample testing, field testing, to be able to ascertain an average of cases in the country. Of course, that is the proper epidemiological procedure in the event of a pandemic. For some reason, Mike, this has always been done in pandemics, but it was suspended as a practice in January 2020. All of these countries didn't do the random sampling, and all you hear from the mainstream media pundits and the kind of people supposedly challenging the government, they're saying, test, test, test. You must test everybody. That's not actually according to the way epidemiology is done traditionally. No, the first thing you do is sample testing in order to ascertain what is the average rate of infection, plus or minus a margin of error for the entire population. It's the first thing you do. You deploy those teams. That didn't happen with any of these lockdown countries. So they have no data, and that's when the problem begins.
Right.
So let's take a look at probably the most high-profile case in terms of a non-lockdown country, Mike, is the country of Sweden. Now, we often hear about the Nordic model, But here is the Prime Minister of Sweden, Stefan Löfven, and he's saying we all as individuals have to take responsibility. We can't legislate and ban everything. That's the Prime Minister of Sweden, Mike. And here is one of the Stockholm residents which spoke to AFP, the news agency. She said, "We trust our government and trust the system in a way that other countries maybe don't as strongly." So maybe that also plays a part in why Sweden doesn't feel that it's necessary to put such forceful measures until the case worsens. Now, we just showed you the numbers. They're well into the same trajectory that we're into. So they were infected at the same time, more or less, Mike. So it's probably not going to worsen. However, if you look at the media reportage for Sweden, which we'll show you in a minute, there's a push right now to demonize Sweden, to say that they're putting millions of lives at risk. But let's look at what life is like right now in Sweden, Mike. Here is a nice picture of the waterfront. And so Sweden, no lockdown. And these are the measures that they have been taking. Common sense, hygiene, interactions, and social distancing. Nothing really super strict, but basically
common sense stuff.
Yeah. Self-isolating. Anybody who's feeling ill, they're going to get medical care or see a doctor. Any of the vulnerable or elderly, they're also encouraged to self-isolate, Mike, but you will see elderly people out in the supermarket shopping and so forth, okay? No Soviet-era queues around the corner at supermarkets. No standing 2 meters apart and waiting to get into supermarkets. They're not doing any of that. You saw the numbers that they've achieved already, very similar to the other non-lockdown countries. However, they have sort of tightened it up in the last couple of weeks. Gatherings are down from 500 to 50 persons. So they are recommending more stringent measures and just caution in general. What's open? Playgrounds and parks, okay? What's also open? Primary, secondary, and high schools. Now, a lot of people, virtue signaling people in the West will be shrieking in horror that Sweden has left their primary, secondary, and high schools really up to the age of 16 open. The reason for that is because their science team basically advocated herd immunity. This is exactly what Boris Johnson and his team initially advocated when they first unveiled their first plan, and they got savagely attacked by the press and by the opposition and by various international NGOs and organizations. Now we've shown you the results after nearly a month of this policy, and well, it looks like Sweden is ahead in the game, as are the other non-lockdown countries. That is irrefutable, Mike. The data is clear for everybody to see. What's also open in Sweden? Pubs, bars, restaurants. How is this possible, Mike? How can you be out having a pint when there's this global pandemic ravaging its way through your country? Are the Swedes somehow better equipped to deal with this? I'm not sure. Well, there is a propaganda campaign, but let's look at what life is like in Sweden. This is Forbes. That's there on one of the waterfront districts there in Scotland. They're having a nice sort of spring drink and lunch.
In Sweden, you mean?
In Sweden,
yeah.
Yes. And let's look. Here's another nice shot, social scene there. This is Stockholm. So, yep, they're not under lockdown, Mike, and they're achieving as good or better results than the lockdown countries. So you have to ask yourself, what's going on there? But here comes the naysayers. Sweden has no coronavirus lockdown, but can it last? There's a whole slew of these articles this week. They're really hammering Sweden. They're really sort of challenging them and saying they must go into lockdown, which, if you think about it, Mike, is kind of pointless at this point. Because whatever virus has entered the country and made its way through the population, it's already there. They're already close to achieving herd immunity in Sweden. And hence they might avoid a second wave that maybe other lockdown countries could face, according to a lot of epidemiological experts. We'll show some of those in a minute. So this is pro-lockdown propaganda. This is how you should be viewing this. And here's much of the same. Sweden, which refused to implement a coronavirus lockdown, has so far avoided a mass outbreak. Now it's bracing for a surge in deaths, Mike. So everybody's out. Sweden took the unusual step of not implementing a lockdown to halt the spread of the coronavirus. So they're saying, look at the framing here. They're saying that Sweden took the unusual step, Mike. Unusual. So their policy seems to be working, but yet it's an unusual step. So couldn't you just as easily say the lockdown countries took an unusual step of performing a giant social engineering experiment that has no historical precedent whatsoever? There are no universal whole nation lockdowns in history. It's never happened, okay? So, and again, the country urged people to practice social distancing, but left places like shops and restaurants open, dangerous places, and breaking the model, followed by countries across Europe and the world. They broke the model of the lockdown, says Business Insider. How dare the Swedes even do that? And this is, again, pro-lockdown propaganda. And so here's The Guardian, as ever, one of the great journalistic paragons, The Guardian. Their headline is, "They are leading us to catastrophe. Sweden's coronavirus stoicism begins to jar." And look at the picture they have of all the beds lined up there. Sweden is playing Russian roulette with its population. That's from another Guardian article before this, Mike. Again, this is pro-lockdown propaganda. They are targeting Sweden, all of these mainstream media reports, Mike. It's obvious. There's a whole wave of them. If you just Google Sweden and lockdown or no lockdown, you'll see exactly this. So this is what some of the Swedish officials have to say here. Here's Anders Tegnell. He's Sweden's chief epidemiologist. He's saying, "There is no evidence whatsoever that doing more at this stage would make any difference. It's far better to introduce stringent measures at very specific intervals and keep them running for as little time as possible." Now, this is the opposite of what we just heard from Dominique Raab.
Absolutely.
And again, going back to the numbers, it seems that Sweden is outperforming the lockdown countries, as is Iceland, Mexico, Japan, Belarus, South Korea, and Taiwan. So you have to ask yourself again, what is going on here? So again, and here is Dr. David Katz, founding director of Yale University Prevention Research Center. And this is what he had to say about lockdowns. He said, "I'm deeply concerned that the social, economic, and public health consequences of this near total meltdown of normal life, schools and businesses closed, gatherings banned, will be long-lasting and calamitous, possibly graver than the direct toll of the virus itself. The stock market will bounce back in time, but many businesses never will. The unemployment, the impoverishment, and despair likely to result will be public health scourges of the first order," Mike. And you notice, Mike, as well, that have you seen much coverage in the mainstream media about failing businesses?
Very, very little. I mean, they have now announced the United States unemployment figures, which are really at 1920s, 1930s levels in terms of, this is a depression you're entering into in the United States rather than a recession.
17 to 20% unemployment right now this week that they're looking at, and that's going to get worse. So, but no stories about the lives ruined, millions of lives ruined in terms of businesses, family businesses that have been in the family for generations, Mike. Historic pillars of the community have been wiped out by this choice, this voluntary choice to implode the economy and shut society down, okay? Now, you have to ask yourself again, is this the right move? Was this really well considered, or could this have possibly been done on not only bad data, Mike, but on impulse as well? Let's look at some of the other experts and see what they're saying, Mike. This is Dr. John Ian Itis, and he is a professor of epidemiology and population health at Stanford University in Palo Alto, California. And he's saying what we know based on some theory and empirical observations is that when you have a lockdown or shelter in place, you hope to diminish the very rapid dissemination of the virus in a wider community, but you run the risk at the same time of a lower scale, but still pretty substantial dissemination of the virus within these closed spaces. So he's saying that we ask the spaces we ask people to stay in. So he's basically saying that there's a danger that you can actually prolong the life of the virus by running lockdown and self-isolating scenarios on the whole population. And he continues here, Mike, and this is quite a stunning statement by Dr. Ian Itis. This was from Journeyman Films, by the way. This video is available online for everyone to see. It's not just throwing everything at the problem and hoping that it will work. This would be medieval medicine. And I'm scared to believe that in the 21st century, we just go blind and throw medieval medicine on the entire population of the entire world. He's talking about the lockdown policy and everything that goes with it, Mike. So that's a pretty amazing statement. And this is also backed up here by Dominique Michel. He's a medical anthropologist from Geneva, very well known in the media and medical community. He's saying closing everything inevitably leads to economic and social disaster. In the absence of the means to apply the best strategy, screening, confinement, and treatment, resorting to a lockdown is an archaic and ineffective measure, but the only one that could be taken. So he is questioning the efficacy, Mike, of this particular policy. And he does go on here. He says, once this collective hallucination is passed, it will be time to make a rigorous post-mortem of health decisions and to seek to understand what happened. Will all of the incredible societal waste is generated. So that is Jean-Dominique Michel, Mike. So you can see there's a number of experts, Mike, that are basically saying that the lockdown policy it's akin to a medieval approach. And as we proved earlier, the non-lockdown countries are doing just as well or better than the lockdown countries. So that really disproves the argument that a lockdown was necessary. Now, it's very hard to erase all of those case studies of non-lockdown countries, but this is what the numbers are telling us right now at this point, Mike, and they're going to tell us more or less the same thing next week.
No, absolutely.
And the week after, and the week after that.
So in the UK, of course, we do have a lockdown, and the police are really unsure how to police it. So many people have seen this already, but Nick Adderley, who's the Chief Constable of Northamptonshire Police, was really warning yesterday that the police could soon increase the level of enforcement that they apply. So let's have a listen to what he had to say.
Of course, at the extreme level, by going out and disobeying the law, you are increasing the chances of spreading this coronavirus and causing many more deaths, unnecessary deaths, in the county. So I want to be clear. Obey the law. Do not fall foul of the legislation that's now in place. We have given the communities 3 weeks to understand what is required and why. As from today, we will start to enforce that. I do want to make the point, though, that my message to the police officers here is one of common sense and discretion, as I said before. So we will not at this stage be setting up roadblocks. We will not at this stage be starting to marshal supermarkets and checking the items in baskets and trolleys to see whether it's a legitimate, necessary item. But again, be under no illusion. If people do not heed the warnings and the pleas that I'm making today, we will start to do that.
So, Patrick, that is a direct threat, really, that he is going to impose this type of draconian situation on the people if they don't do what they're told. But this is what he said there was wrong on so many levels. First of all, there is nothing in the legislation which defines what is a legitimate item to be bought in a shop and what is not.
Legitimate and necessary items.
Right. So he is making this up as he goes along. And he is instructing he is arguing that in the future he will instruct his police to enforce or make a judgment, use their common sense about what a legitimate item is. There's nothing in the legislation which empowers him to do that. He is operating beyond his authority. Now,
and I might add, Mike, just sorry to interrupt, but the tone of that statement is stunning. It's almost like the headmaster saying, I don't want to punish you, class, but there's a few bad apples in here, and if they don't shape their act up, we're going to put the whole class in detention. We're very sorry, but we're going to have it's tough love.
Well, that's absolutely right. Now, as you would expect, there's been some pushback on this. The National Police Chiefs Council have pushed back on it. They've said the Chief Constable of Northamptonshire Police has clarified his earlier statement about police checking people's shopping, confirming that this will not happen. Well, of course, he said in the statement that it will not happen until he decides that it will happen, right? So that's a non-statement from the NPCC. Priti Patel then, what did she have to say? This is not appropriate. Let me be clear on that. This is not the guidance. This is a very important statement as well, because she's talking about guidance. He is justifying his behaviour because he sees his role and his police force's role as to uphold the guidance from the government. Well, I'm sorry, but guidance is guidance. Law is law.
That's right.
The police's role is to uphold the law, not to uphold the guidance. So the guidance is there to offer people advice. If the government feels that the guidance is not doing its job and that they want to enforce that guidance, then they've got to make it law. And that means going back to Parliament and making it law. So the police out of control here. And I have to say, I do wonder whether he made that statement with a view to really, because the government is totally into behavioural analytics at the moment. They are watching social media. They're assessing the mood of the country. And I just wonder whether he made that statement a bit of a guinea pig to run a little experiment for the analysts. And that may well
drifted
be
out,
and see what the response is. That may well be what was going on in Scotland when they were suggesting that they were going to remove juries from trials as well. So that is a possibility, but nonetheless, the police have to be forced, required to do their jobs, not to operate outside their authority. This has to end. And Patrick, you were on the Hoe yesterday, and what do we have here?
Well, this is a police van flanked by two officers, basically doing a sweep to make sure nobody is sitting on the park benches on the first real day of spring coming into the Easter weekend. And so it was extraordinary, including old age pensioners. Some of them were also occupying those benches, Mike. But that's what was happening out in one of the most beautiful spots really in the country.
So the park benches all have yellow and black tape on them?
Yeah, the ones in the foreground they've been taped up, but the ones in the background, you are permitted to sit there, but not for long, and not if there's a police patrol in the area. So, and here is also one of the officers with his remote control flying a drone overhead simultaneously at the same time. I can't imagine what the drone was doing, but I suppose it was filming, Mike. Residents there. I mean, it's probably the one place where you don't need a drone really is the Plymouth waterfront.
Right.
It's got the best visibility of
anywhere in the city.
Anywhere
Absolutely.
in the city. So for all the children who want to go and roll your Easter eggs this Easter weekend, we're sorry to say that's probably not going to be permitted. But if you want to go out and watch the police playing with the drones, that's permitted.
Devon and Cornwall Police selling tickets for that, are they?
But don't stay stationary. Make sure you keep moving while you're watching.
Yes. So what is Professor Witkowski saying?
Yes, this is Professor Nutt Witkowski, and he is the former head of biostatistics, epidemiology, and research design at Rockefeller University. And this is what he has to say about being outdoors and respiratory diseases. He says, for a respiratory disease, the flu ends during springtime. People spend more time outdoors because outdoors, the virus cannot easily spread. He said that is a form of containment, spending more time outdoors. This is one of the top epidemiologists really in the United States as well. This is also on Journeyman Films. You can find his interview online. And basically he rounded this out, Mike, by saying, going outdoors is what stops every respiratory disease. And that's interesting, Mike, because this is what a lot of scientists are saying, but some of the governments are saying the opposite. They're saying, no, the weather's getting warm, the sun's out, but you need to stay indoors more now. This is the message that's coming from some governments in Europe and also in the United States.
But it's no lockdown. The end to the lockdown is not in sight. This is the Eye newspaper yesterday telling us that. Patrick,
it's unbelievable, Mike. You would see this on a national daily newsstand. The Orwellian overtones.
Well, the Orwellian overtones, indeed. I mean, we'll just remind everybody what 1984, the movie, looked like. It's just incredible where we're going with this. But look, we've been warned about this for a number of weeks now. This is The Independent. Coronavirus UK lockdown will be indefinite until a vaccine is found, warned scientists advising government. And I think that was from the middle of March or so, 16th of March 2020. Indefinite until a vaccine is found.
How could they make such a claim? I have to ask, Mike. How could they make such a? That's not a scientific claim.
No, it's not. It's not. But of course, this is the newspaper reporting that, so you don't know exactly what was said. But nonetheless, this is the message that's being given out. Well, good news, Patrick, because we mentioned this a few days ago, but it's now happening. New COVID-19 test labs. The first one has been opened. Matt Hancock has opened that. The biggest diagnostic lab network in British history is how he's describing it. And so he's opened a new site in Milton Keynes. This is the first of 3 lighthouse labs to be set up across the country, which will dramatically increase the number of coronavirus tests that can take place each day. Each lab will have the capacity to test tens of thousands of patient samples, and prioritising NHS staff is the beginning of that so that they can get these people back to work, is what they're claiming. But ultimately, Patrick, I think we're heading towards everybody being tested because, of course, we're not going to be allowed out again. It seems to be the message that has been running through, a thread that's been running through all the live streams from the beginning, without our immunity passport. And we can only get an immunity passport if we've had a test. But maybe that won't be enough because this was from Bloomberg yesterday. Coronavirus may reactivate in cured patients, according to the Korean CDC. Will it be sufficient to have a test and a passport? Probably not. I think we're heading towards mandatory vaccination on this.
Let me comment on this, Mike. This is also a misleading headline in the sense that they're cherry picking a statement that's made about a single case or a few cases in Korea, and they're saying that this is what the Korean officials are saying broadly, and it's not a broad statement. It's not been analyzed yet. We're still early in the timeline. They can't make definitive scientific general claims yet.
Right.
But the media is very keen to try to do this.
Right, and the other thing that they didn't make any comment in this article about was how good was the test. So they were making a statement about a patient would test negative one day, positive the next day. And well, was that an aberration in the test? Don't know. But anyway, this is heading towards vaccination, Patrick. And what I want to highlight is this, because we've seen many of these types of papers, scientific papers on this issue. This is a news feature on the PNAS website, avoiding pitfalls in the pursuit of COVID-19 vaccine. So let's just have a look at this. As they race to devise a vaccine, researchers are trying to ensure that their candidates don't spur a counterproductive, even dangerous immune system reaction known as immune enhancement. So it says researchers need to understand in particular whether the vaccine causes the same types of immune system malfunctions that have been observed in past vaccine development. They say since the 1960s, tests of vaccine candidates have shown a paradoxical phenomenon. Some animals or people who received the vaccine and were later exposed to the virus developed more severe disease than those who had not been vaccinated. So they're absolutely clear in this, Patrick, that there is a risk in rushing ahead with a vaccine that hasn't been properly tested, which seems to be what we're doing. And of course, even if it is properly tested, because many of the vaccines that we've seen this result from in the past have gone through the full testing regimen. So just continuing on this a little bit, Patrick, of course, the main driver of the British policy has been Imperial College. Well, I just wanted to highlight something here about Imperial College and where they're getting a lot of their funding, which of course is the Bill and Melinda Gates Foundation, and this is the Bill and Melinda Gates Foundation website. And so I just wanted to run through some of the grants that they've had, and this is just in 2 years, and it's millions of dollars, Patrick, and in fact
tens of millions, Mike.
Well, indeed. In fact, in the last 15 years or so, they've had $634,905 from the Bill and Melinda Gates Foundation. And of course, it's Bill Gates. If we wanted to pick one individual on this planet at the moment who's pushing the hardest towards mandatory vaccination on this, and more than that, he's pushing for the vaccination to be tagged in some way so that once you've received it, you can be scanned to show that you have received it. So this is equivalent to an immunity passport then.
A digital certificate, he's calling it.
Yeah, right.
But we don't know what form that's going to, what form he wants that to take. But Microsoft is involved in ID 2020, Mike, which is a broad program to sort of design and solve the problem of that digital ID,
right,
or that virtual ID problem. So that, and again, Microsoft this is Bill Gates' company. He might not be running it now, but you can't deny the association there.
So there's a huge incestuous relationship between these various organizations and a massive conflict of interest with Imperial College here, I think.
And Imperial College is the ones who delivered the doomsday modeling that caused the government to change its policy early on, Mike.
Right.
They intervened. 500,000 dead, 200,000, 240,000 dead. Neil Ferguson and these same people that also brought us the foot and mouth debacle under the Blair government. And a lot of people forget about that. And we're starting to see a lot more similarities, Mike, between the fallout of foot and mouth as it affected Cumbria,
right,
and the Pennines, and the fallout from this lockdown, which will not just affect one area, Mike, but the whole country and the international economy as well, and trading partners, and
absolutely.
The collateral damage is impossible to measure at this point.
Absolutely. Now, if you like what the UK Column's doing and you would like to support us, then please head over to ukcolumn.org/community. There are options to help us out there. And I just want to say a massive thank you to everybody that has joined us in the last few weeks. Your support much appreciated, and we couldn't do this without you, so thank you very much. Let's move on to this then. Now, we showed this before. This was an article on the BBC, and we were making the point that despite the fact that they hadn't changed the URL, they had changed the content of the article. They changed the headline. They changed the text, and we were making the point that the text that they originally had on that article said this: every year more than 500,000 people die in England and Wales. Factor in Scotland and Northern Ireland, and the figure tops 600,000. The coronavirus deaths will not be on top of this. Many will be within the normal number of expected deaths. It was a point conceded by Sir Patrick, that's the government's expert on this, at a press conference on Thursday, when he said there would be some overlap between coronavirus deaths and expected deaths. He just didn't know how much overlap. Well, in the new version of that article, Patrick, they are quoting Sir David Spiegelhalter, who's from Cambridge University, who's saying many people who die of COVID, the disease caused by coronavirus, would have died anyway within a short period, and that's very sad, but that's his position. So I just wanted to highlight a graph that they've put on this page, which is showing the normal male death rate, the normal female death rate, and the coronavirus death rate. And the point is, they all show the same trend. So what he is saying here, and this data has come from Sir David Spiegelhalter, and what he's saying here is coronavirus, there's nothing abnormal about it. There's nothing unusual about it. It is behaving absolutely within the normal bounds of death in the country.
So what you're saying, Mike, is they're both tracking each other. There's really no variation.
There's no variation. There's nothing special about this at all. And this is sort of highlighted here, Patrick, by this article from Italy. We'll just translate it for you. Coronavirus in Treviso. The comparison, deaths in hospital like last year. So the total number of deaths in the Treviso hospitals in the first 3 months of 2020 is in line with that of previous years. The data is incontrovertible. The interpretation open to question. Now, the reason they're saying that is because they then go on to ask, would the numbers have been different in the event that Italy had not carried out its lockdown? So that's the question, that's the open to question part there. But they're saying quite clearly the data is incontrovertible. The situation in their hospitals in the north of Italy were exactly the same this year as it was in the previous years. But we were using the Italian situation as justification for taking the draconian measures that have been taken in this country. And yet every time there's a statement coming out from Italy at the moment, it's demonstrating that either the numbers were overestimated or or the situation was absolutely what they've seen in previous years.
And not only that, Mike, the computer modeling team, like Neil Ferguson and these people who were trying to predict the death total in the UK, Mike, they were also going on a case fatality rate that was hugely inflated, Mike, and looking at Italy and places like this where they didn't have the data, they hadn't done random sampling testing nationally. They hadn't done a lot of testing, period. So the case fatality rate, of course, that's people carrying the virus versus those who have died of it. It wouldn't have been known, Mike, but it looked a lot bigger than it was. That fed into the modeling clearly from Neil Ferguson and these people, and so they came up with this gigantic doomsday prediction that has no basis at all in actual reality.
But now we've got a bit more propaganda from The Guardian. Again, hundreds of UK care home deaths not added to the official coronavirus toll. And they're suggesting that industry body estimates up to 1,000 people may have died in care homes so far, because that doesn't happen normally, Patrick. And they're saying more than 120 residents of the UK's largest charitable provider of care homes are thought to have died from the virus in the last 3 weeks. Thought to have died. These people haven't been tested. They haven't been, there's been no autopsies done, so they don't know. They can only think about it. While another network of care homes have reported 88 deaths. So what is this really about, this article? Well, this again...
This is a talking point that's being pushed out right now, isn't it?
But in this case, the article is about this. Reliance on registered death certificates means ONS data on COVID-19 deaths to care homes lags behind other figures.
Right.
So what they're really doing is trying to reinforce the narrative that we've seen in the last few days. Began with Channel 4 News on Tuesday, that there's some disparity in the ONS statistics because they're delayed. The ONS statistics are delayed, but that doesn't change the ultimate picture. And but what we did see, as we reported on Wednesday's programme, is that the ONS then, clearly under pressure because of this situation, have brought some statistics forward from the next release that they do next week into the release that the statistics release that they issued this week. So we see that the ONS is starting to experience some kind of external pressure on this. And the other point to make on this, Patrick, is that in the past, if we look at flu statistics, and we've had statements from Public Health England on the numbers of flu deaths and so on, those numbers have always been higher than what the Office for National Statistics have shown. And because the Office for National Statistics, for all their faults, does a better job of this sort of thing ultimately than the other authorities.
And this is what we're seeing trending on social media, Mike, when we were looking at this morning at Twitter and Facebook. There's a lot of people pushing this idea, and these mainstream articles are saying they're downplaying, the UK's downplaying the coronavirus totals. But actually, if you look at the reporting that the UK column has done, Mike, over the last few weeks, clearly there's evidence of the opposite. And I think that's been demonstrated quite clearly on your previous programs, and we may talk about that on Monday and Wednesday as well.
Absolutely. So a couple of quotes, Patrick.
Well, we've spoken to some healthcare professionals around the country to get a pulse on what's going on in emergency rooms and also in ICUs. This is from Northern Ireland. This is from a medical professional who's currently in government or previously in government. So there's been 2 deaths in the Altnagalvin area, approximately 200,000 population there, and there's been 2 deaths. He was in his 80s with dementia and heart problems. Doctor informs me only 5 out of 16 ICU beds were being used. No one's on a ventilator. Doctors standing around on their mobile phones. Okay, this is from Northern Ireland, and here, this is from London. ICU beds seem full, like at peak busy time, but the hospital is not being overrun. This is from a major London General Hospital. These are just comments that have been shared with us by people working in the NHS or around the NHS and in government, Mike. And that's just a very small sample of what we've received.
Absolutely.
In the last
we've
week.
been speaking to quite a number, and we're getting the same story from most of them. Right. Yes, so let's just briefly move on to this. Of course, the Express was reporting MPs handed an additional £10,000 each to help them work from home during lockdown. They're saying MPs are being offered an additional £10,000. It has emerged the extra cash injection will come on top of the £28,270 for London MPs and the £25,430 non-London MPs already receive to cover their office costs as the UK is gripped by the deadly coronavirus disease. So the Express correctly pointing out that MPs are being given extra money basically to run Skype. This is quite credible because, Patrick, the last time I looked, Skype was free. There was no license fee for that. So
hold on, Mike. Are you telling me that they've awarded themselves a 10 grand salary increase per year to stay at home?
No, right. So this is a very important point. This is what Reuters was saying, because that's a false claim.
According to Reuters.
It's a false claim because they didn't award themselves this. They were awarded it by the Independent Parliamentary Standards Authority. It's not an additional to their salary. It's a one-off bung. So
Right.
anybody suggesting that it's a pay rise, this is not quite correct. But nonetheless, what the Reuters has done here with this headline, false claim, British MPs award themselves extra 10,000 in expenses. That is a carefully crafted headline,
Wow.
which implies that they didn't get the money.
So are they accusing the Express of publishing fake news there, Mike?
Well, I'm actually accusing Reuters of publishing fake news.
It looks
because,
like Reuters is publishing
yes,
fake news. That is
so
incredible, the amount of doublespeak going on. Try to follow that one, Mike.
absolutely. But we should say that perhaps Robert Jenrick will be using the £10,000 to keep driving to Hereford because he seems to like doing that. So another government member of the government we've had one in Scotland, now we've got one in England, basically breaking the lockdown. Well, you've got to wonder, do they know something that we don't? Because if they actually believed that it was vital for people to stay in their homes, would they not do it themselves?
You would think so, yes. So it's not just a case of them being cheeky or derelict, Mike. They actually are not, they're not afraid of leaving the house.
No, indeed. Well, look, we're right out of time, Patrick. We'll just leave it on this one. This was sent to us. We like seeing how people are reacting to what's going on, but this is somebody falling through the sky, and the headline is "Skydiver who forgot parachute dies of coronavirus." What can we say?
My favorite part about this, Mike, is up in the right-hand corner location, your mom's house.
Yes.
4:20 p.m. So if anybody knows any more information about the identity of this gentleman, please get in touch with the UK Column. We'd like to know more information. This is an unconfirmed story. Of course, we don't know if it's real or if it's true, but if anybody knows about this gentleman, please send us any information you have.
Yes. So on that note, we will leave it for today. Thank you very much for joining me, Patrick. Thank you for joining us. As Patrick says, we will be back at 1 p.m. As usual on Monday. It is Easter Monday, but we're going to do the program on Monday anyway, so we will see you then. Have a great weekend. Have a great Easter. See you then. Bye-bye.